If you're here, it's because you care. You're a BCBA supervisor who works hard to support your RBTs, ensure high quality intervention, and meet ethical and compliance standards. But let's be real, supervision is exhausting. It often feels like no matter how much effort you put in, you're still juggling RBT turnover, inconsistent performance, and interventions that don't always stick. You might have thought, hmm. I want to support my RBTs better, but I am already stretched way too thin. Or I have so many things to track. How can I possibly fit in one more thing? Or I treat all my RBTs the same. Shouldn't that be enough? If any of this resonates with you, then this training isn't just helpful, it's necessary. Studies show that burnout among BCBAs is a growing concern, with cultural responsiveness and effective supervision strategies playing a significant role in reducing stress and improving outcomes. Hey, you guys, I'm Christy Wilson, a BCBA, longtime supervisor, and someone who's been in your shoes. I was trained to follow the ethics code, write technically sound behavior plans, and deliver structured supervision. But what my training didn't cover was how to lead with cultural humility, how to have the tough conversations, adapt feedback to individual needs, and recognize when a supervisee isn't disengaged. They just don't see themselves reflected in the supervision process. This course was born from the moment I realized that treating everyone the same wasn't working. When I started leading with humility, listening more than instructing, and building relationships before jumping into protocols, everything changed. Feedback stuck, supervisees grew, clients thrived. So if you've ever felt like something's missing from your supervision, but you can't quite name it, you're in the right place. This training is about closing the cultural humility gap in supervision and transforming the way that we lead. Let's do this together. The real problem isn't you. It's that traditional BCBA supervision training never prepared us for this. We were taught what to do, deliver feedback, track progress, follow ethical guidelines, but we were never taught how to adapt our supervision to meet the needs of different people. The gap has real consequences, y'all. Supervisees don't feel heard, so they disengage. RBTs don't implement feedback because it doesn't reflect their lived experience. Supervisors feel frustrated, overwhelmed, and stuck in the cycle of burnout. And the hardest part, you might not even realize cultural differences are playing a role in these challenges. This isn't about fixing anyone. It is about making supervision work better for everyone. Research suggests that behavior analysts who lack training in cultural humility often struggle with supervisee engagement and intervention effectiveness. The BACB Ethics Code explicitly highlights the need for cultural responsiveness in service delivery. I know all of this because I've been there. Early in my career, I believed that fairness meant treating everyone the same. I had high expectations, I followed the science, and I prided myself on consistency. But then I started noticing something. The RBTs that I connected with the most, they were the ones whose experiences aligned with mine. The ones who seemed disengaged, they weren't unmotivated, they just didn't see themselves in the way that I was teaching. The more I personalized my supervision, meeting RBTs where they were instead of expecting them to adapt to me, the more effective my feedback became. Compassionate care and therapeutic relationships with caregivers are essential components of effective behavior analysis. Studies emphasize that culturally competent supervision results in better training outcomes and higher retention of RBTs. That's when I realized cultural humility isn't about making supervision better. It's the key to making it work at all. This training isn't about adding more to your plate. It's about reframing your approach so that supervision feels like less of a struggle and more like a collaboration. By the end of this training, you'll recognize how cultural humility can make supervision easier, not harder. Identify the small, high-impact changes that improve RBT engagement without increasing your workload. And learn how to embed cultural humility into supervision without sacrificing efficiency. The integration of cultural humility into supervision has been shown to improve RBT job satisfaction and overall client outcomes. This is not another compliance training. This is about making your real-world supervision experiences more effective, more meaningful, and less exhausting. To make this transformation happen, we're going to walk through a structured step-by-step framework. By the end of this training, you'll be able to recognize how cultural humility differs from cultural competence and why it is essential in effective ABA supervision. We're also going to look at identifying common blind spots and barriers that prevent supervisors from embedding cultural humility in their supervision practice and learn strategies to overcome them. We're going to build trust and psychological safety in supervision to foster open, culturally responsive conversations with RBTs. Apply culturally responsive strategies in supervision to ensure that feedback, training, and performance expectations are adapted to individual supervisee and client needs. And integrate cultural humility into long-term supervision structures, including mentorship, feedback loops, and self-reflection practices to sustain a meaningful change. Before we dive in, let's go over a few housekeeping items. So how this training is going to work. You'll hear several code words throughout the training. Make sure to write them down as they appear. You'll need them for the post-training quiz. At the end of the training, you'll complete a short quiz, which will include questions about the code words and the content that we've covered. Once you've passed the quiz, you'll receive your CEU certificate. And always remember, feel free to pause and replay sections if you need more time to process the information. This training is designed to fit your schedule. Let me give you your first code word, maple, M-A-P-L-E, maple. Now that we've set the stage for what this training will accomplish, let's begin with the foundation, understanding cultural responsiveness in ABA supervision. Why start here? Well, because before we can change anything, we need to be crystal clear on what cultural humility is, why it matters, and how it impacts the way we supervise. The application of cultural humility in supervision fosters better collaboration and engagement between BCBAs, RBTs, and families, ultimately leading to more successful interventions. This first step is about shifting our perspective. It's about realizing that cultural humility isn't extra work. It's the key to making everything else in supervision more effective. Let's dive in. Before we can change anything about how we supervise, we need to fully understand why cultural humility is essential in ABA supervision. This step lays the foundation for everything that follows. Cultural humility isn't just about awareness. It's about action, accountability, and lifelong learning. Research shows that behavior analysts often struggle to embed cultural humility in their practice, despite its clear impact on supervision and client outcomes. Without cultural humility, we risk applying interventions in ways that don't align with our RBTs or clients' lived experiences. And when that happens, engagement drops, intervention fails, and supervisors end up frustrated, feeling like they're repeating themselves without real progress. Beyond supervision, cultural humility influences client care. When RBTs lack cultural responsiveness, they may struggle to build rapport, misunderstand family priorities, or unintentionally impose their own values on behavior change goals. Studies indicate that incorporating cultural responsiveness improves client outcomes and strengthens supervisor-supervisee relationships. Additionally, the BACB Ethics Code highlights the professional obligation of behavior analysts to provide culturally responsive services, reinforcing the importance of cultural humility in ethical supervision practices. Let's be honest. Many of us were never trained in cultural humility, and that's not our fault. But now we have the opportunity to shift how we supervise and provide services, and that starts here. I want you to think for a moment. Think about a time when an RBT struggled to implement your feedback. Could cultural factors have played a role? Write down your thoughts. Cultural humility is different from cultural competence. Instead of viewing culture as something we master, Cultural humility reminds us that we will always be learning. It's about recognizing our biases, acknowledging power imbalances, and being open to change. In supervision and client interactions, cultural humility means engaging in self-reflection to understand how our experiences shape our expectations, adapting our communication and feedback styles to meet the needs of RBTs and clients, ensuring that interventions align with family and client values, not just our clinical goals, and acknowledging that families are the experts on their own experiences. Our role is simply to guide, not dictate. To fully embrace cultural humility, we need to be clear about what it isn't. It's not about memorizing every cultural norm. It's not about avoiding conversations about differences. It's not about assuming we have arrived at cultural competence. And it's not about making assumptions about an RBT's or client's values based on stereotypes. Instead, cultural humility is about intentional learning, adapting, and meeting people where they are. It's about recognizing that being an effective BCBA means being open to feedback from supervisees, clients, and our families. Imagine that you are supervising an RBT who struggles to connect with a client's family due to cultural differences. The family has expressed concerns that the behavior plan does not align with their values, and the RBT seems frustrated that they are not following the recommendations. How would you guide the RBT to approach this situation with cultural humility? Write down 2 or 3 specific strategies you would suggest and reflect on how these approaches might change the outcome. Okay, and now we're going to look at some other possible approaches. Guide the RBT to ask open-ended questions and listen actively to the family's concerns. For example, can you tell me more about how this plan aligns or doesn't align with your family's values? Instead of insisting on one approach, support the RBT in working with a family to adapt interventions in ways that are both effective and culturally relevant. Remind them that research supports individualized intervention strategies over one-size-fits-all strategies. Cultural humility means recognizing that relationships take time to develop. The RBT may need to show consistency, respect, and flexibility before the family fully engages. Role play ways that the RBT can demonstrate cultural responsiveness in their interactions. The culturally informed functional assessment interview is a valuable tool for identifying cultural factors influencing behavior, allowing for interventions that better align with a family's values and expectations. Self-check. After brainstorming solutions, ask yourself, how would these strategies change the outcome? What barriers might still exist, and how could they be addressed? One of the biggest misconceptions about cultural humility is that it's extra work. In reality, it makes supervision and intervention actually way more effective. When RBTs and clients feel heard, they engage more, absorb feedback better, and are more likely to follow through with interventions. Think of it this way. Would you rather repeat yourself 10 times because an RBT doesn't connect with your approach, or adjust your strategy once and see them succeed? Cultural humility reduces misunderstandings and increases buy-in with RBTs and clients. It strengthens trust with families, leading to greater collaboration and treatment planning. It helps interventions succeed because they align with family values. And it prepares RBTs to work in diverse settings, making them more adaptable and effective practitioners. Let's take a look at another scenario. A BCBA is supervising an RBT who has been working with a client for several months, but the client's family seems disengaged. The parents rarely attend sessions, decline opportunities for parent training, and do not implement intervention strategies at home. The RBT expresses frustration, stating that the family just doesn't seem to care. The BCBA notices that the RBT has been giving direct, highly structured feedback without much discussion or collaboration. What culturally humble strategies could the BCBA use to support the RBT and engage the family more effectively? The BCBA could guide the RBT in asking open-ended questions to understand the family's priorities and challenges. For example, they could ask, what would make these strategies more manageable for your family? Doing this instead of assuming disinterest allows this approach to center on problem solving together. The BCBA might recognize that the RBT's structured feedback style doesn't align with the family's communication preferences. A more relational, conversational approach may build trust over time. The BCBA could encourage the RBT to reflect on whether their expectations for engagement are based on their own cultural norms. Research shows that cultural humility involves stepping back and allowing families to define what meaningful participation looks like for them. What assumptions might be influencing your interpretation of family engagement? How can cultural humility shift your perspective and approach? We've talked about how cultural humility impacts supervision, but what about client interactions? Consider this. A family hesitates to implement a behavior plan because it contradicts their cultural norms. How do you respond? A parent doesn't make eye contact or is quiet during sessions. Do you assume they're disengaged, or do you explore cultural factors at play? An RBT expresses discomfort in discussing certain topics with a client. Do you dismiss it, or do you work with them to find a culturally appropriate approach? When we use cultural humility, families feel empowered to express their values and concerns. Clients receive interventions that are meaningful and respectful to their background, and RB teams become more confident in navigating cultural differences. Supervision isn't just about training RBTs. It's about ensuring that they're prepared to provide culturally responsive care to clients and families. That's what makes this shift so impactful. Think about a time when a client's cultural background influenced their response to treatment. How did you or the RBT navigate that situation? What would you do differently now? Let's consider some more real-life scenarios. You're in a team meeting and a colleague expresses frustration about a client's family not following through with recommendations. They say, they just don't seem to care about the treatment plan. What might be the best way to respond? Would you A, agree it's frustrating when families don't follow through and they need to be held accountable? B, ask whether cultural factors might be influencing the family's engagement and explore possible barriers? Or C, say nothing. It's not your place to correct a colleague's viewpoint. The best answer here is B. Cultural humility requires supervisors to recognize potential biases and consider alternative perspectives. A new supervisee asks why they should consider cultural background when designing interventions. They argue that evidence-based practices should be applied uniformly. How do you respond? Would you A, explain that ABA interventions should be adapted to align with the client's cultural values while remaining evidence-based? B, agree. Scientific principles don't change based on culture, so interventions should stay consistent. Or C, avoid the conversation. Man, this is too complex to discuss in supervision. The best answer here is A. Cultural humility means adapting interventions in a way that is both ethical and effective. Even when we understand cultural humility, we may not recognize the blind spots in our own supervision. What if we're unintentionally missing something? In step 2, we'll uncover the barriers that prevent supervisors from fully integrating cultural humility and how to break through them. And here's your next code word, PEBBLE. P-E-B-B-L-E, PEBBLE. Now that we understand why cultural humility is essential, we need to take a deeper look at why it's not already embedded in most ABA supervision practices. Even the most well-intentioned supervisors can have blind spots. hidden biases, assumptions, or gaps in knowledge that impact how we supervise and how RBTs engage with clients and families. Cultural humility is a lifelong journey, not a one-time achievement. Research suggests that many BCBAs believe that they are being culturally responsive, but often fail to recognize how implicit biases or systematic barriers influence their approach. If we aren't aware of these blind spots, we can't change them. One key factor in addressing these blind spots is recognizing the role of compassionate care and supervision. Research by LeBlanc, Taylor, and Marches in 2020 highlights that supervisors who demonstrate compassion and emotional intelligence foster stronger supervisee relationships and better long-term outcomes. Without this awareness, we risk reinforcing disengagement and ineffective supervision practices. What makes blind spots tricky? Well, we don't see them. They exist because of our personal experiences, education, and cultural upbringing. And without intentional reflection, they continue to shape how we supervise and interact with clients. This step will help us identify, challenge, and address these blind spots so we can provide more effective and culturally responsive supervision. Think about a time when you were certain that your supervision approach was effective, but an RBT or client didn't respond as expected. Could a cultural factor have been at play? Write down your thoughts. Blind spots in supervision don't mean that we're failing as supervisors. They mean that we have opportunities to grow. But before we can address them, we need to understand why these barriers exist in the first place. Where do these blind spots come from? A focus on technical skills over interpersonal skills. Research tells us that while technical ABA skills are crucial, interpersonal and relational skills in supervision are just as vital. Many supervisors focus heavily on behavior reduction and skill acquisition while overlooking the human component of supervision: empathy, relationship building, and understanding cultural differences. Traditional ABA trainings have historically emphasized behavior over context. Our field prioritizes observable, measurable behaviors, sometimes at the expense of understanding the cultural factors influencing those behaviors. While ABA provides powerful tools for behavior change, traditional training often lacks guidance on how to adapt interventions to align with a family's cultural values and lived experiences. This can lead to interventions that are technically sound but fail to gain family buy-in because they do not align with what the family sees as meaningful or valuable. Supervisors may also default to what has worked for them. Without exposure to different perspectives, we might assume that our approach is the best approach. Many of us were trained in specific ways, and we tend to replicate those strategies with our RBTs and clients, without realizing that those methods may not work for everyone. If we were trained in environments that lacked diversity, we may not recognize when our own assumptions about behavior, communication, or supervision style are culturally specific rather than universally applicable. Time constraints and caseload pressures make reflection difficult. We know this, right? Cultural humility requires slowing down and engaging in self-reflection, but high caseloads and productivity demands often push this aside. Many supervisors operate under tight schedules, juggling multiple RBTs and clients. This can lead to prioritizing efficiency over relationship building, making it easy to overlook the importance of cultural responsiveness in day-to-day interactions. Taking time to reflect on cultural differences in supervision and client care, it may feel like a luxury, when in reality, it is essential for meaningful progress. Lack of structured training on cultural humility. Many BCBAs report feeling unprepared to navigate cultural differences because it wasn't introduced in their formal training. Unlike ethics, assessment, and behavior reduction strategies, Cultural humility is not always explicitly addressed in coursework or fieldwork. As a result, many supervisors enter the field without a structured framework for integrating cultural considerations into supervision and client programming. Without ongoing training and support, blind spots persist, often without the supervisor even realizing it. A lack of ethno-cultural empathy. Research by Russell et al. In 2009 on ethnocultural empathy in healthcare suggests that supervisors who develop empathy for diverse perspectives foster better engagement and retention of supervisees. Failing to consider how cultural impacts learning style, communication, and problem solving creates a barrier for effective supervision. Now let's look at some common blind spots that result from these barriers that we just identified. Assuming one-size-fits-all supervision works for everyone. Many supervisors use a standardized approach for all RBTs, believing consistency equals fairness. However, different learning styles, communication preferences, and cultural backgrounds mean that some RBTs may need a more personalized approach to supervision and training. Overlooking the power dynamics in supervision. Supervision inherently comes with an imbalance of power. RBTs, especially those from marginalized backgrounds, may feel hesitant to voice concerns, ask for clarification, or share challenges. Without addressing this imbalance, supervisors risk missing valuable feedback that could improve the working relationship and intervention effectiveness. We'll talk about this a little bit later. Not questioning our own biases and assumptions. We all carry biases shaped by our upbringing, experiences, and professional training. Without regular self-reflection, these biases can influence how we evaluate RBT performance, interpret clinical behavior, and structure interventions. For example, if a supervisor unconsciously equates eye contact with engagement, they may incorrectly assume an RBT or client who avoids eye contact is uninterested or inattentive. This is another one that we are going to visit later too. Expecting compliance rather than collaboration. Some supervisors may unintentionally create an environment where RBTs feel expected to simply follow instructions rather than engage in meaningful discussions about interventions. Cultural humility means inviting collaboration, not just compliance, and ensuring that RBTs feel empowered to ask questions and share insights. Ignoring cultural influence on client behavior. A behavior we classify as challenging may actually be a cultural expression or a form of communication. For instance, a client who avoids physical contact may not be resistant to social engagement, but instead following a cultural norm around touch or personal space. Without cultural awareness, we risk pathologizing normal behaviors, seeing family non-compliance as resistance rather than misalignment. When families don't follow through with behavior plans, it's easy to assume that they're being resistant. However, it's often an issue of misalignment. Our recommendations may not fit within their cultural values, daily routines, or lived experiences. Instead of labeling a family as non-compliant, cultural humility calls for an open dialogue to understand their concerns and adjust interventions accordingly. Not addressing the emotional toll of cultural barriers. Cultural misunderstandings can lead to frustration and burnout, not just for supervisors, but also for RBTs and families. Supervisors who practice cultural humility recognize these challenges and create spaces where RBTs feel supported in navigating them. Which of these blind spots do you recognize in your own supervision? Write down one that resonates with you and why. We're going to refer to this again later in the training, so hang on to it. Now I want to share a personal story about a time when I realized my own cultural blind spot and how it impacted a client and their family. Early on in my career, I worked with a family whose child engaged in frequent stereotypy behaviors. From a clinical standpoint, I didn't see the behavior as a concern. It wasn't interfering with learning, safety, or daily functioning. Because of this, I didn't prioritize it as a target for intervention. However, every time that we met for parent training, the child's mother would bring it up. Each time, I'd explain why we didn't need to focus on reducing it. I gave her all the clinical reasons. It wasn't functionally problematic, it wasn't harming him, and suppressing self-stimulatory behavior without justification could be unethical. I believed that I was helping her understand our approach, and I assumed that over time she would come to see it my way. But session after session, she continued to bring it up. And then one day, our conversation shifted. Instead of just expressing that she wanted the behavior to stop, she shared why. It wasn't simply that it made her child look different. It was that in their culture, blending in was deeply held valuable. Their community valued subtlety, going under the radar and not standing out. This child's stereotypy wasn't just different, it was highly visible, making the child, and by extension, the family, stand out in ways that were uncomfortable and familiar with their cultural norms. This moment changed everything for me. I had been operating solely from my own clinical and cultural perspective, assuming that what I saw as not clinically significant was also not significant to the family. But I had completely overlooked their lived experience and what this behavior meant in their world. That conversation was one of the most impactful experiences of my career. It forced me to take a step back and ask myself, am I truly listening to families? Am I considering what is meaningful and important to them beyond my own professional training? From that day forward, I made a commitment to approach every case with more cultural humility, to ask why something matters to the family, but before deciding whether or not it should matter in my treatment planning. Have you ever assumed that a family's concerns weren't clinically significant, only to later realize they were culturally significant? How might this perspective shift your approach to parent collaboration? Recognizing blind spots is the first step. The next step is learning how to address them in practical, sustainable ways. It's not enough to just be aware of our own biases. We have to actively work to change our supervision practices in ways that foster inclusivity, trust, and engagement. When supervisors take the time to reflect and adjust, they not only improve their relationships with RBTs, but also ensure that clients receive interventions that align with their family's values and lived experiences. The key is to move from unconscious bias to intentional action. Let's look at some strategies to uncover and reduce blind spots in supervision. Engage in self-assessment regularly. You could use tools like the cultural responsiveness self-assessment to identify areas where you may need to grow. Set reminders to revisit your self-reflections every few months. Blind spots evolve, and so should your awareness of them. Research by LeBlanc, Taylor, and Marchese in 2020 highlights that self-assessment fosters compassionate supervision, helping supervisors refine their ability to respond to supervisees with empathy and individualized support. Seek diverse perspectives. Encourage your RBTs to provide feedback on supervision practices. Actively listen when RBTs or families express concerns about interventions or communication. Attend cultural competency training or mentorship groups that expose you to perspectives outside of your own. Rossall et al. In 2009 found that developing ethnocultural empathy enhances a supervisor's ability to relate to and support diverse teams, increasing engagement and retention. Adapt supervision to individual RBT learning styles. Some RBTs may prefer direct instruction, while others thrive with collaborative problem solving. Consider cultural influences on communication, learning, and motivation. Research emphasizes that balancing technical skills with relational supervision strengthens the supervisory relationship and improves long-term supervisee competency. Check in regularly with your RBTs to ensure that they feel that their supervision is effective and meets their needs. Ask before assuming. Instead of assuming disengagement, ask RBTs and families about their experiences, challenges, and preferences. For example, you could ask, what would make this supervision process more effective for you? When a family does not follow through with recommendations, dig deeper into why before making conclusions about their commitment. Consider that family and supervisee engagement may be shaped by cultural norms, requiring adjustments in communication to increase participation. Model cultural humility for RBTs. If you openly acknowledge your own learning process, your RBTs are more likely to do the same. For example, you could say, I realize I've been providing feedback in a way that might not align with how you best learn. Let's talk about what works better for you. Demonstrate a willingness to adapt supervision strategies based on feedback rather than expecting RBTs to adjust to you. Have you ever unintentionally dismissed a supervisee's concern due to a cultural misunderstanding? How would you handle it differently now? All right, let's look at some more real-life scenarios. During supervision, you tell an RBT, you're really articulate. Your English is so great. You intended it as a compliment, but your RBT seems uncomfortable. What do you think you should do? A, reassure them that you meant it as a compliment and move on. B, reflect on why this comment might be problematic and apologize for any unintended impact. Or C, ignore it. If they don't say anything, they're probably fine. The best answer here is B. Cultural humility involves recognizing and addressing microaggressions to create a safer supervision environment. A parent repeatedly disregards your intervention suggestions, saying, this isn't how we do things in our culture. What should you do? A, explore their cultural perspectives and collaborate on a plan that aligns with their values. B, insist on following the standard intervention. Best practices should not be compromised. Or C, stop making recommendations and let them decide on how to proceed. Your best answer here is A. Cultural humility requires collaborative problem solving rather than imposing a one-size-fits-all solution. Now that we've uncovered the blind spots in our supervision, the hidden biases, assumptions, and barriers that can derail our efforts, it's time to focus on the human connection that makes everything possible, including change. Awareness alone won't move the needle if RBTs don't feel safe enough to speak up, ask questions, or challenge ideas. Why is this critical? Well, because psychological safety is the bridge between insights and meaningful change. Even the most well-intentioned supervisors can struggle to implement culturally responsive supervision if RBTs feel that they can't speak up, ask questions, or challenge an approach that doesn't align with their experiences. Without trust, feedback remains one-directional and growth is limited. In step 3, we're going to shift our focus from what's missing to what's needed: trust, respect, and psychological safety. This is the foundation where true collaboration begins. Without it, even the best supervision strategies will fall flat. Let's talk about how to build a supervision culture where RBTs feel seen, heard, and valued so that growth can truly take root. This is going to mean that we're creating supervision spaces where RBTs feel comfortable sharing their perspectives, strengthening relationships through active listening and culturally responsive communication, and addressing power imbalances in supervision to foster collaboration, not just compliance. As we think about these blind spots and which ones we are affected by, we're going to keep looking at ways to address these blind spots. Hold on to your thoughts and notes about this content because we're going to come back to it later in the training. We've uncovered our blind spots and recognized how they impact our supervision and client care. Now we need to shift our focus to how we create an environment where RBTs feel safe to share their perspectives, ask questions, and engage in meaningful learning. This is where cultural humility, trust, and psychological safety come in. Cultural humility is an ongoing process of self-reflection and openness to learning from others' lived experiences. It requires recognizing and addressing power imbalances in supervision. Psychological safety refers to an environment where individuals feel comfortable speaking up, admitting mistakes, and asking for help without fear of embarrassment or punishment. Research has shown that when psychological safety is high, teams perform better, employees feel more engaged, and learning is more effective. For RBTs, psychological safety means feeling confident that their voices matter, that they can discuss challenges, provide feedback, and explore new strategies without fear of judgment or negative consequences. Without this foundation, even the most well-intentioned cultural humility efforts will fall flat. Think about a time when you didn't feel comfortable speaking up in a professional setting. What impact did that have on your engagement in learning? Now, think about a time when you did feel safe. How did that experience differ? Psychological safety isn't something that happens by chance. It must be intentionally cultivated by the supervisor. As BCBAs, we are not just responsible for teaching technical skills. We're responsible for creating a space where RBTs feel empowered to grow. Research shows that supervisors who prioritize psychological safety create stronger learning environments where supervisees are more engaged, retain information more effectively, and feel more confident in their clinical decision-making. A key component of this is cultural humility, acknowledging that we do not have all the answers and actively seeking to learn from our RBT's diverse experiences. On the other hand, a lack of psychological safety leads to higher stress levels, disengagement, and decreased overall job satisfaction. Data from the BACB highlights trends in supervision demographics, showing that the growing diversity among RBTs requires supervisors to adapt their approach to foster inclusive supervision practices. Now let's look for a moment at what happens when there's no trust and safety in supervision. RBTs hesitate to ask for help because they fear being judged. They pretend to understand feedback rather than admit confusion. They follow instructions without critically thinking about interventions. They disconnect from supervision and client care due to stress or fear of making mistakes. Supervisors experience higher turnover rates, leading to increased time spent on onboarding new staff rather than developing existing team members. And clients may receive less effective services because RBTs are reluctant to ask questions or clarify treatment plans. The cost of a lack of psychological safety is steep, not just for the RBT, but for supervisors, clients, and the organization as a whole. Research has found that environments with low psychological safety result in burnout, lower job satisfaction, and increased staff attrition. Without trust, teams become stagnant, errors increase, and the quality of service provided suffers greatly. On the other hand, when psychological safety is present, RBTs and the entire supervision ecosystem benefit in powerful ways. You can engage in meaningful discussions and ask thoughtful questions, leading to stronger clinical decision-making and a deeper understanding of interventions. RBTs may feel comfortable acknowledging mistakes and seeking guidance, which accelerates skill development and prevents small errors from turning into major problems. RBTs challenge assumptions and suggest alternative approaches, fostering a collaborative problem-solving environment that strengthens intervention outcomes. You can build stronger connections between the supervisor and RBT, the client, and the client's family, creating a cohesive support system for the client's progress. RBTs are more likely to stay in their role, reducing staff turnover and improving continuity of care, which is crucial for both client progress and team stability. RBTs demonstrate increased confidence in implementing interventions, reducing hesitation and uncertainty in sessions. RBTs also report higher job satisfaction, and then there's lower burnout rates, leading to more sustainable and engaged workforce. And RBTs feel empowered to advocate for their clients' needs, ensuring that interventions are both effectively and culturally responsive. A supervision culture built on psychological safety is not just beneficial, it is transformational, and it is a must. It enhances learning, improves client outcomes, and builds a stronger, more resilient team. Supervisors who prioritize trust and safety don't just improve their RBT's performance, they elevate the entire field of ABA. Take some time to take this short self-assessment to reflect on the level of trust and safety in your supervision. Feel free to write your answers down so that you can reflect on them later. When an RBT makes a mistake, how do you typically respond? Do you A, correct them immediately, sometimes in front of others? B, address it later and focus mostly on what went wrong? Or C, provide private constructive feedback and frame it as a learning opportunity? How do you often ask your RBTs questions or express concerns during supervision? Rarely or never, then mostly listen and follow instructions. Occasionally, but usually have to prompt them. Or often, they feel comfortable bringing up concerns and engaging in discussions. How do you invite feedback from your RBTs? A, you don't. You assume that they will speak up if they have concerns. B, you ask occasionally, but don't always create structured opportunities. Or C, you regularly invite feedback through structured self-check-ins and open discussions. When you think about the answers that you provided on this assessment, consider looking at how this may identify or reflect to you your levels of cultural humility within your supervision. Based on your responses, identify one area where you can strengthen trust and safety in your supervision. If you're unsure, consider asking an RBT for feedback on their experience in your supervision sessions. Let's consider a real-world example of how psychological safety, or the lack of it, can shape an RBT's experience. A BCBA is supervising an RBT who has been working with a client for a few weeks. The client has a history of engaging in problem behavior when transitioning between tasks. The behavior plan outlines a reinforcement-based strategy, but during a session, the RBT insisted on verbally prompting the client multiple times, which escalated frustration. The BCBA, watching the session, interjects in front of the client and their family, saying, "That's not the procedure. Stick with the plan." The RBT immediately stops, nods, and continues. But over the next few weeks, the BCBA notices that the RBT stops asking questions during supervision, avoids situations where they might make mistakes, and becomes hesitant when implementing behavior plans, leading to inconsistency in treatment intervention. What went wrong? Here are some thoughts. The BCBA's correction was public rather than private, which may have caused embarrassment. The RBT may now fear making mistakes rather than seeing them as a learning opportunity. And the supervisor missed a chance to support the RBT's confidence and skill building. Let's examine what we could have done differently, particularly in accordance with research. The role of psychological safety. Research by Taylor, LeBlanc, and Nosek in 2019 emphasizes that compassionate supervision enhances psychological safety, which is critical in creating an environment where RBTs feel safe to take risks, ask questions, and learn from mistakes. In this case, the supervisor's public correction likely caused the RBT to feel exposed and fearful to future mistakes, leading to disengagement. A more effective approach would involve private constructive feedback that frames mistakes as learning opportunities rather than failures. The impact of supervision demographics. The BACB certification data suggests an increasingly diverse workforce in behavior analysis, meaning that supervisors must be mindful of how cultural expectations and communication styles influence how feedback is received. The RBT in this scenario may come from a cultural background where public correction is perceived as deeply embarrassing or disrespectful, reinforcing the importance of private, culturally responsive feedback. Rebuilding trust after a breach in psychological safety. The supervisor now has an opportunity to repair the relationship and restore trust. Key strategies could include acknowledging the impact of the public correction. For example, I realized that I gave you feedback in a way that might not have been the most constructive. I'd like to talk about how I can support you better in future sessions. Encourage the RBT to self-reflect. Ask them, what challenges did you experience in that session? And then you're going to have to actively listen to their perspective. Also, provide a safe space for future learning, reinforcing that asking questions and making adjustments is part of professional growth rather than a sign of incompetence. Have you ever had a supervisor who made you feel uncomfortable about making mistakes? How did that impact your learning? What strategies could have helped create a safer learning environment for you? Building trust and psychological safety takes time, but it starts with consistent, intentional actions. Research by Edmondson in 1999 and Watkins et al. In 2025 suggests that when supervisors prioritize psychological safety, team members are more engaged, retain information more effectively, and demonstrate higher levels of problem solving and creativity. Without it, supervisors are more likely to withhold concerns, disengage, or avoid learning opportunities altogether. Taylor, LeBlanc, and Nosek in 2019 found that when supervisors integrate compassionate care principles, such as acknowledging the emotional needs of supervisees and validating their experiences, psychological safety increases significantly. Here are key strategies that supervisors can use to create a safe and effective learning environment for RBTs. First, set the tone for psychological safety from day one. The first few interactions between a supervisor and an RBT set the stage for whether the RBT perceives supervision as a safe space for learning. Supervisors should be intentional about establishing expectations early by stating, I want you to feel comfortable asking questions, even if you think that they're small. Mistakes are expected and will always be treated as learning opportunities. Or, if something isn't working for you, I want to know so that we can adjust it together. Supervisors should also model openness and approachability, ensuring that their actions align with these verbal commitments. This might include acknowledging their own learning process, showing curiosity about the RBT's perspective, and avoiding punitive language when corrections are needed. Number 2, create a feedback-rich supervision environment. Many supervisors unintentionally create one-directional feedback loops where they evaluate and the RBT listens. However, research suggests that effective supervision requires mutual feedback. To foster a more dynamic and engaging supervision environment, you can regularly invite RBTs to share what works for them by asking things like this. How do you prefer to receive feedback? What's one thing that I could do to make supervision more useful for you? It's important to normalize the process of RBTs giving feedback to the supervisor by incorporating structured check-ins. Psychological safety in learning environments is associated with increased engagement and stronger professional relationships. Setting the expectation that asking for help is a strength, not a weakness. Reinforcing that honesty in conversations about struggles leads to growth and not consequences. Be mindful that feedback should be continuous, not just reactive. Providing space for ongoing conversations rather than only offering feedback when mistakes occur builds trust and strengthens the supervisory relationship. 3, recognize and reduce power imbalances in supervision. One of the biggest barriers in psychological safety is unacknowledged power dynamics in supervision. Supervisors may assume that RBTs feel comfortable speaking up, but research shows that power differentials often prevent open dialogue. The BCBA RBT relationship is inherently hierarchical, and many RBTs, especially those from marginalized backgrounds, may not feel comfortable advocating for themselves. When power imbalances go unaddressed, supervisees may hesitate to share challenges or voice concerns, which leads to missed opportunities of learning and disengagement ultimately. A key strategy to reduce power imbalances is acknowledging them openly and taking steps to create structured opportunities for RBTs to share their perspectives without fear of retaliation. For example, implement anonymous feedback forms or structured debriefs after difficult cases where RBTs can share concerns without pressure. Implement a collaborative supervision model where RBTs contribute to problem-solving discussions rather than receiving directives. Supervisors should also be mindful of how their tone, body language, and word choices influence the supervisory relationship. Simple shifts, such as using inclusive language, like let's work through this together, instead of you need to do it this way, can make supervision feel more collaborative rather than authoritarian. 4. Normalize and reframe mistakes as essential for growth. Many RBTs enter supervision with the fear that making mistakes will result in punitive consequences. To build a culture of learning, supervisors must explicitly frame mistakes as expected and valuable. Instead of reacting to mistakes with frustration, shift the narrative. Mistakes are how we learn. Research on supervision effectiveness shows that supervisors who model vulnerability and acknowledge their own past mistakes create environments where supervisees feel safe to take risks and learn. Practical strategies for reinforcing this concept could include share your own mistakes and what you learned from them. When giving corrective feedback, start by identifying what went well before addressing areas for improvement. Use private, constructive feedback rather than public corrections. Studies on supervision suggest that individuals process feedback more effectively when it is framed as a growth opportunity rather than a performance critique. Implement a learning log where RBTs document challenges and what they gain from them, reinforcing the idea that mistakes drive professional development. 5. Build psychological safety through micro moments. Psychological safety is not built through one conversation. It is developed through small, consistent interactions over time. Each moment of engagement with an RBT is an opportunity to reinforce a culture of trust and openness. Use affirming language when RBTs take initiative. For example, I really appreciate you bringing that up. This encourages open communication. Pause before reacting to an RBT's mistake to ensure that your response is constructive rather than critical. Instead of focusing on what went wrong, shift the conversation to problem solving and skill building. Model vulnerability by sharing times when you, as a supervisor, have learned from your mistakes. This normalizes continuous learning and reassures RBTs that growth is an expected part of the process. Encourage dialogue by regularly inviting feedback about the supervision process. Asking questions such as, what's something I could do to make supervision more helpful for you, creates a safe space for discussion and growth. And provide structured opportunities for RBTs to express concerns, such as scheduled check-ins or reflective discussions, ensuring that psychological safety is not just an expectation, but a built-in part of supervision. And 6, validate and respect cultural differences. Acknowledging that RBTs come from diverse backgrounds and may have different communication styles, including how they give and receive feedback. In some cultures, direct feedback is seen as constructive, while in others it may be perceived as confrontational or disrespectful. Research suggests that cultural responsiveness in supervision is linked to higher retention rates and improved supervisee satisfaction. When supervisors take the time to understand cultural nuances in communication, learning, and problem solving, they reduce misunderstandings and build stronger working relationships. Adapt your feedback style to align with the RBT's cultural background while still maintaining clear expectations. This may involve using more indirect language, offering feedback in a private setting, or balancing corrective feedback with positive reinforcement. Encourage your RBTs to share their preferences regarding how they receive feedback by asking a question like, what type of feedback helps you grow the most? Or, is there a way I can provide feedback that feels more constructive for you? Be mindful that in some cultures, questioning authority may not be encouraged, making it harder for RBTs to express concerns and ask for clarification. Supervisors should actively invite dialogue and reassure RBTs that their input is valued. Let's take a look at a few real-life examples. An RBT expresses that they feel uncomfortable discussing cultural differences in supervision. How do you respond? Do you A, reassure them that supervision is a safe space and invite their perspective? B, move on. It's their responsibility to speak up if they have concerns. Or C, ask for specific feedback about how you can improve cultural discussions in supervision. The best answer here is C. Supervisors must actively invite feedback and create a psychologically safe space. All right, how about this one? A supervisee disagrees with your clinical decision, but seems hesitant to express their concerns. What should you do? Do you A, acknowledge the power dynamic and encourage open dialogue? B, assert your authority. Your role is to guide their learning. Or C, assume that they're going to speak up if they feel strongly about it. The best answer here is A. Reducing hierarchical barriers promotes trust and open communication. Trust opens the door, but action is what keeps it open. In step 3, we focused on creating a safe, respectful environment where RBTs can learn and grow. But creating safety is just the beginning. Now we need to move from creating the right conditions to using those conditions to deliver real impact. In step 4, we'll take the supportive foundation that we've built and apply it to our everyday supervision practices. How do we adapt feedback to match someone's cultural background? How do we handle difficult moments in real time? This step is about embedding cultural humility into what we do, not just what we believe. Supervision is dynamic. There will be moments when an RBT hesitates to ask for clarification, when a family expresses concerns that you didn't anticipate, or when cultural misunderstandings create tension. How we handle those moments describes and determines whether we reinforce trust or erode it. In step 4, we'll focus on turning awareness into action by practicing cultural humility in day-to-day supervision, navigating difficult conversations with RBTs and families, and using real-time feedback strategies that reinforce trust and growth. Reflect on one area where you can improve in creating a psychologically safe supervision environment. Consider a recent interaction. What went well? What could have been handled differently? Now that we have uncovered blind spots and strengthened trust through psychological safety, it is time to move from awareness to action. Cultural humility must be embedded in daily supervision practices to ensure lasting change. Culturally responsive supervision means actively considering the diverse backgrounds, values, and experiences of RBTs and using that awareness to enhance training and professional development. Hayes in 2022 emphasizes that supervisors often misconceive cultural competence as a checklist, whereas cultural humility requires ongoing reflection, adaptation, and openness to learning from supervisees. Research shows that when supervision is culturally responsive, RBTs report higher job satisfaction, better skill acquisition, and improved collaboration with clients and families. Despite recognizing its importance, many supervisors struggle to integrate cultural humility into daily supervision. This step identifies barriers preventing implementation and provides practical strategies to overcome them. What has prevented you from addressing cultural humility in supervision? Time, uncertainty, competing priorities? Earlier in this training, we uncovered the blind spots that can silently shape our supervision, those internal biases and assumptions that we may not even realize we hold. Now we shift our focus to the external barriers that prevent us from putting cultural humility into consistent practice. While blind spots reflect what we may not see, barriers reflect what gets in the way, even when we do see the need for change. It's all about turning awareness into action by identifying what's holding us back and learning how to move forward with intention. Even when supervisors value cultural humility, multiple barriers prevent them from consistently applying it in their supervision practices. Research highlights several systemic and practical reasons why cultural humility remains underutilized in supervision. Many supervisors manage large caseloads, administrative duties, and compliance requirements, leaving little time for deeper cultural discussions. Supervision often focuses on technical skills and immediate performance rather than relationship building and cultural awareness. Supervisors often lack structured accountability systems to reinforce cultural discussions. Cultural humility may feel like an extra task rather than a core component of effective supervision. And without structured accountability systems, cultural discussions can become inconsistent and deprioritized over time. Many supervisors were never formally trained in cultural humility, leading to uncertainty about how to address cultural topics appropriately. Fear of making mistakes or unintentionally offending supervisees may cause supervisors to avoid cultural discussions altogether. Supervisees may avoid discussing cultural topics because they fear saying the wrong thing or being perceived as insensitive. Supervisors may feel unsure about when and how to bring up cultural considerations without seeming intrusive or inappropriate. The fear of being corrected or challenged by supervisees can discourage supervisors from engaging in conversations about culture. A fixed mindset about cultural competency can discourage supervisors from engaging in ongoing learning and reflection. And a lack of psychological safety in the supervision environment can prevent both supervisors and RBTs from openly addressing cultural concerns. Traditional ABA approaches prioritize compliance over individualized intervention. Many supervisors were trained in a one-size-fits-all approach to ABA, which assumes that interventions can be applied uniformly across supervisees and clients. Traditional supervision often prioritizes compliance over individualized, culturally responsive approaches. Supervisors may feel pressure to stick with the plan rather than adopt an individual needs and backgrounds. And the lack of flexibility in supervision frameworks limits the ability to adapt feedback and training styles to meet diverse learning needs. Many organizations don't prioritize cultural humility in supervision or provide formal training on it. Supervision structures often lack policies that encourage cultural discussions, making it difficult for supervisors to embed cultural humility into standard practices. Without mentorship, peer collaboration, or structured learning opportunities, supervisors must seek their own development, which may feel overwhelming. And the absence of peer learning groups or professional development networks can make it harder for supervisors to refine and reinforce cultural responsiveness. Implicit biases can shape how supervisors evaluate an RBT's performance, communication style, and approach to problem solving. Supervisors may unintentionally assume that their own cultural perspectives and experiences are universal, leading to missed opportunities for meaningful adaptation. When cultural humility is not actively practiced, biases can influence hiring decisions, feedback, and perceptions of professionalism. And without structured feedback loops, supervisors may not receive honest input about their cultural responsiveness from their supervisees. Without a structured plan for integrating cultural humility into supervision, initial efforts may fade over time. Competing demands can lead supervisors to revert to previous habits, making cultural considerations inconsistent. A lack of formalized reinforcement strategies, such as supervision checklists or feedback loops, can prevent supervisors from sustaining long-term cultural competency practices. Now that we've identified the barriers that get in the way of applying cultural humility, this step focuses on actionable solutions. We'll explore practical, sustainable strategies to embed cultural responsiveness into your existing supervision routines, making it a natural and consistent part of how you lead. 1. Structure supervision to prioritize cultural considerations. Many supervisors struggle to find time for cultural discussions because they see them as separate from core supervision tasks. The key is to integrate them into existing structures. Open your sessions by saying, "Have you encountered any cultural or communication barriers with clients this week?" Use structured check-ins to normalize discussions. Ensure that cultural conversations don't feel like an extra task, but a natural part of supervision. Try this strategy in action. You can use supervision logs to document cultural considerations and follow up on them in subsequent sessions. Why does all of this matter? Well, research indicates that when cultural discussions are built into supervision routinely, RBTs feel more comfortable raising concerns, leading to better intervention outcomes. 2. Adapt supervision to the RBT's learning style and background. Traditional supervision often assumes a one-size-fits-all approach. However, research suggests learning preferences vary across cultures. Some RBTs prefer direct instruction, while others thrive in collaborative discussions. You could ask your RBT, "How do you learn best? What supervision strategies are the most helpful to you?" And then adjust accordingly based on their feedback. Recognizing an RBT's background allows supervisors to tailor training and feedback, ensuring more effective learning and engagement. Supervisors can use individualized learning plans tailored to each RBT's background and strengths. I'll share a resource with you at the end of this training that can help with this. Studies show that culturally responsive teaching improves skill acquisition and retention. Personalized supervision ensures that RBTs are receiving guidance in a format that is meaningful and accessible to them. Model cultural humility in your own supervision approach. Many supervisors hesitate to engage in cultural discussions due to fear of saying the wrong thing. However, research shows that modeling cultural humility encourages supervisees to do the same thing. You can acknowledge their areas of growth by saying something like, "I appreciate your perspective. Can you share more about how this impacts your work?" Normalize ongoing learning. "I'm committed to refining my approach. Let's explore this together." Supervisors must recognize that cultural humility is not a fixed skill, but an ongoing practice that evolves with experience and reflection. Try this strategy in action. Supervisors can implement monthly self-reflections and invite feedback from RBTs to improve their own cultural responsiveness. Why does this matter? Well, supervisors who demonstrate humility and openness set a precedent for their supervisees, fostering an environment where cultural considerations are valued. This approach also helps to mitigate unconscious bias by encouraging active listening and perspective taking. Here's number 4. Advocate for institutional support and resources. Many organizations don't prioritize cultural humility, making it difficult for supervisors to implement meaningful changes. Supervisors can advocate for training opportunities, mentorship programs, and policy updates that emphasize cultural responsiveness and supervision. Here's another strategy in action. Establish peer learning groups or community of practice meetings where you can share strategies, challenges, and successes related to cultural humility. Seek out external professional development opportunities such as webinars, workshops, or research articles that provide continued learning. And again, why does this matter? Research highlights that supervisors who engage in structured learning communities develop stronger cultural competence and report higher confidence in addressing cultural considerations in practice. Build accountability systems for cultural responsiveness. Without accountability, cultural humility can become an afterthought rather than a standard practice. Develop supervision review checklists that prompt discussion and cultural considerations during every session. Implement structured feedback loops where RBTs can provide input on the cultural responsiveness of their supervision experience. Research shows that workplaces with accountability structures in place are more likely to sustain long-term cultural competency initiatives. Foster a growth mindset around cultural competency. Many supervisors avoid cultural discussions because they worry about making mistakes. However, embracing a growth mindset allows for continued learning. Reframe cultural responsiveness as a skill that evolves over time, just like technical ABA competencies. Try this strategy in action. Implement a supervisor learning journal where you as a supervisor can document reflections on cultural interactions and ways to improve. Remember that a growth mindset approach has been shown to increase openness to learning and long-term competency development. Cultural humility is an ongoing process, not a competency to master. Think about your last supervision session. Did you make space for cultural considerations? If not, what prevented it? What is one small change that you can make to embed cultural humility in your next session? Training methods must be adapted based on both the RBT's background and the cultural norms of the clients they serve. A standardized approach may not always be effective, as cultural differences influence learning styles, communication preferences, and expectations for feedback. Supervisors must adjust their training strategies to foster engagement, retention, and skill development in culturally diverse supervisees. Let's look at some key adaptations that can be made in your supervision practice to mitigate these barriers. Some RBTs come from cultures where direct feedback is seen as disrespectful. Others expect it. Always ask, how do you prefer to receive feedback? Nonverbal communication, such as eye contact and tone, can vary differently across cultures as to what they mean. Supervisors should be aware of these differences to ensure that feedback is received as intended. You can provide feedback scripts with culturally responsive phrasing that align with the RBT's comfort level and communication norms. Research suggests that when feedback is delivered in a culturally attuned manner, supervisees are more likely to apply recommendations effectively and engage in open discussions about their performance. In some cultures, questioning authority is discouraged. Supervisors should explicitly invite input. Your insight is valuable. I'd love to hear your perspective. Power dynamics may impact how RBTs interact with supervisors, especially if they come from hierarchical culture where deference to authority is expected. Recognize that some RBTs may be hesitant to challenge authority. You can try this strategy in action. Use role-playing exercises to practice culturally responsive communication, modeling ways to encourage feedback and collaboration. Encourage the use of anonymous feedback opportunities to give RBTs space to share concerns that may not feel comfortable raising in direct conversation. Why does this one matter? Well, studies show that workplaces with more agrarian communication styles foster greater trust, leading to more open discussions and improved performance outcomes. If a client's family shows specific cultural practices, supervisors should help RBTs navigate these dynamics respectfully. Family expectations regarding behavioral interventions, parental involvement, and the definition of appropriate behavior may differ across cultures. Supervisors should coach RBTs on adapting interventions to align with family values while maintaining ethical and evidence-based practices. Supervisors can provide case studies with culturally relevant scenarios and guided discussions to help RBTs critically analyze and problem solve how to integrate cultural awareness into their interventions. Again, research suggests that culturally tailored approaches improve rapport with families and increase adherence to behavior plans, leading to better client outcomes. Think about a time when you had to adjust your communication, feedback, or training approach based on a supervisee's or client's cultural background. What worked well? What would you have done differently next time? Step 3 emphasized psychological safety, but fostering a safe environment is only part of the equation. Supervisors must also actively create space for cultural discussions. This requires intentionality, modeling vulnerability, and establishing clear expectations that cultural humility is an ongoing conversation rather than a one-time event. Here's how. Set the expectation that cultural conversations are encouraged. Normalize cultural discussions from the start by explicitly stating, culture shapes the way we interact with clients and families. Let's make it a regular part of our discussions. Emphasize that cultural humility is a shared value in your supervision space and not just an add-on. Supervisors should encourage ongoing discussions about culture rather than viewing cultural competence as a static goal. Use weekly discussion prompts to engage RBTs in ongoing cultural conversations. Integrate open-ended reflection questions, such as, can you share an experience where cultural differences impacted session? Research shows that when supervisors explicitly invite cultural discussion, RBTs are more likely to share challenges, leading to problem solving in real time. Address cultural missteps with humility. Encourage a culture of learning rather than correction when cultural missteps occur. Frame mistakes as opportunities for growth rather than failures, reinforcing that cultural humility is a journey and not a destination. Use debriefing forums after cultural misunderstandings to promote learning rather than blame. Encourage supervisors and RBTs to reflect on what happened, why it occurred, and how to improve future interactions. Research supports that supervisors who model humility and accountability in their own cultural learning foster a safer, more open supervision environment. Think about a recent cultural discussion or missed opportunity in supervision. How did you handle it? What would you do differently next time? Let's look at some real life scenarios. You supervise an RBT who comes from a culture where direct criticism is seen as disrespectful. You notice they avoid eye contact when you provide corrective feedback. What's your best approach? A, adapt your feedback style to be more indirect while still maintaining clear expectations. B, continuing providing direct feedback. Your role is to ensure competency. Or C, avoid giving corrective feedback altogether. The best answer here is A. Cultural humility requires flexibility in supervision approaches while upholding professional standards. During a team meeting, a staff member makes a culturally insensitive joke, and others laugh. An RBT looks visibly uncomfortable but doesn't say anything. What do you do? A, address the comment and reinforce the importance of cultural respect in the workplace. B, say nothing. If the RBT has an issue, they should bring it up themselves. Or C, pull the staff member aside privately later. Your best answer here is A. Supervisors must model cultural humility by addressing issues in real time. It's time for your next code word. Our next code word is sunset. S-U-N-S-E-T. Sunset. It's one thing to start implementing cultural humility, but how do we ensure that it sticks? Step 5 focuses on creating lasting systems of accountability, mentorship, and feedback so that cultural humility remains a permanent standard in supervision. Before we move forward, let's practice how to use this new mindset that you're developing. Select one recent supervision session and analyze it through a cultural humility lens. Reflect on the following questions. Did I create space for cultural discussions? If not, what prevented it? Did I adapt my communication and feedback style based on the RBT's background? Was there an opportunity to model cultural humility that I may have missed? What's one change that I will implement in my next session to enhance cultural responsiveness? Then write a brief reflecting on these questions and small action goals to improve cultural humility in your next supervision session. Research shows that self-reflection enhances cultural awareness, accountability, and long-term behavior change. So thanks for taking some time to reflect. Up to this point, we have focused on identifying gaps, fostering trust, and embedding cultural humility into daily supervision practices. Now we shift towards making cultural humility a measurable, repeatable standard in supervision. This ensures cultural responsiveness is not left to chance, but becomes an ongoing, structured practice that benefits RBTs, clients, and future supervisors. Cultural humility must be operationalized, meaning it must be clearly defined, observed, and measured within supervision sessions. As BCBAs, we know this. It's foundational to our science. Without clear expectations, cultural responsiveness risks becoming a passive goal rather than an active component of professional development. Let's look at some ways that we can do this. Define specific observable and measurable behaviors that indicate cultural humility in supervision. For example, each supervision session will include a discussion of cultural considerations related to client care. Establish expectations in written supervision policies to reinforce accountability. Research highlights that when supervisors incorporate cultural responsiveness benchmarks, supervisees report greater confidence in applying these concepts in their work. Use a cultural responsiveness supervision rubric. A rubric helps quantify cultural humility in supervision, ensuring that it consistently is addressed and evaluated. Some example categories to include in a rubric might include the frequency of cultural discussions, adaptation of trainings based on supervisee backgrounds, supervisor modeling of cultural humility. Think about this strategy in action. Supervisors can use self-assessment and peer reviews to evaluate their own cultural responsiveness. Implement rubric-based evaluations at set intervals to measure cultural responsiveness progress. Why does this matter? Having structured tools for assessment allows supervisors to track their own development and identify areas for continued growth. Watkins et al. In 2025 highlight that measurable benchmarks in training improve the sustainability of cultural humility efforts. Integrate cultural humility into performance evaluations. Make cultural humility a standard metric in supervisor and supervisee performance evaluations. For example, supervisees provide feedback on how well their supervisor integrates cultural responsiveness into training and mentorship. When cultural humility is included in formal evaluations, it signals that it is an essential, non-negotiable aspect of high-quality supervision. Ertl, Ellis, and Collier in 2003 emphasized that structured evaluations help reduce power imbalances, ensuring that feedback is culturally competent and valued and applied. What would cultural humility look like as a measurable standard in your own supervision practice? To sustain cultural humility in supervision, feedback must be ongoing and bidirectional, meaning that both supervisor and supervisee must engage in continuous dialogue. Creating a structured feedback loop ensures that cultural responsiveness remains a priority and leads to meaningful improvements over time. But how do we do this? Build a routine cultural responsiveness check-ins. Integrate standardized reflection questions into every supervision session. For example, have any cultural factors impacted your work this week? How did you navigate them? Did you feel comfortable discussing cultural concerns in our supervision? Why or why not? Normalize discussing cultural challenges and successes as part of professional growth. Research suggests that routine check-ins help reinforce cultural humility as a core component of supervision rather than an occasional conversation. Implement anonymous feedback opportunities. Some RBTs may feel uncomfortable discussing cultural concerns openly due to power dynamics in the supervisor-supervisee relationship. Provide anonymous digital surveys or feedback forms where supervisees can share their experiences with cultural responsiveness and supervision. Some of your example survey questions can include, did you feel that your supervisor integrates cultural humility into your supervision? Have there been moments where cultural factors impacted your work that you didn't feel comfortable discussing? Why does this matter? Research suggests that when given a confidential avenue for sharing concerns, supervisees are more likely to provide honest and actionable feedback. Research also found that anonymous feedback systems lead to more honest and actionable cultural discussions. Encourage supervisors to seek feedback on their own cultural responsiveness. As a supervisor, you should model humility by actively soliciting feedback from RBTs about their own cultural responsiveness. For example, you could say, I want to ensure our supervision space is inclusive and culturally responsive. Is there anything I could be doing differently to better support you in this area? As a supervisor, you can use peer consultation or mentorship groups to gain additional feedback and refine your cultural humility skills. Research highlights that when supervisors openly invite feedback, it fosters psychological safety, leading to more meaningful and constructive cultural discussions. Use feedback to drive continuous improvement. Feedback is only valuable when action is taken in response to it. Supervisors should analyze trends in feedback data and adjust their practices accordingly. If multiple supervisees report discomfort bringing up cultural topics, supervisors must introduce structured discussion prompts to encourage open dialogue. Studies show that supervisors who integrate ongoing feedback cycles into their practice develop stronger, more culturally responsive teams. Think about the last time you received feedback on your cultural responsiveness as a supervisor. How did you use it? What structures can you implement to ensure ongoing meaningful feedback from your supervisees? You guys, this is where it's at for me. This is what drives me to better myself as a supervisor and share it with you through trainings and material development. Embedding cultural humility in supervision is not just about individual practice. It's about shaping the future of the field. As supervisors, we're not only guiding today's practitioners, but also laying the foundation for the next generation of behavior analysts. The way that we teach, mentor, and model cultural humility today will shape how our field evolves in the years to come. This is our opportunity to leave a lasting impact. We need to make our field stronger. And how we do that is through our supervision practices every day. But how do we do this? Model cultural humility in every supervision session. Supervisors must lead by example. We have to demonstrate the willingness to learn, unlearn, and refine our approaches. One thing that you could say in your supervision might be, I've realized I made an assumption about a cultural practice last week, and I want to take a moment to revisit that and adjust my approach. Normalize acknowledging cultural blind spots and showing openness to feedback from supervisees is so important. Research shows that when supervisors actively model cultural humility, their supervisees are more likely to integrate it into their own practice. Look at this from a bigger picture standpoint. Imagine a field where every supervisor commits to lifelong learning and cultural humility. This shift could transform the way behavior analysis serves diverse communities, improving outcomes for clients and strengthening our profession as a whole with its ethical integrity. As a supervisor, create peer mentorship and supervision networks. Create the opportunities for collaborative learning and mentorship among colleagues. Establish peer learning groups where you can discuss culturally complex cases. Encourage case study discussions focused on real-world cultural challenges. Organizations could consider implementing structured mentorship programs that connect experienced, culturally responsive supervisors with those who are still developing these skills. Supervision networks create built-in accountability for cultural humility, allowing supervisors to learn from and support one another. Again, imagine if every BCBA had access to a mentorship program focused on cultural humility. The field would shift from reactive cultural awareness to proactive cultural competence, strengthening the quality of services provided worldwide. How cool would that be? Encourage future supervisors to engage in cultural competency trainings. Ensure that any new supervisors that you're working with receive formal training on cultural humility and its role in effective supervision. Provide recommended reading lists, workshops, or continuing ed opportunities focused on cultural responsiveness. You could encourage your supervisors in training to complete a self-assessment on cultural responsiveness as part of their mentorship process. Research suggests structured training programs improve long-term application of cultural humility principles. Collier in 2023 found that embedding cultural responsiveness as a core competency reinforces its necessity in ethical supervision. Let's dream. What if cultural humility training became a required part of every supervision curriculum? Imagine a future where new BCBAs enter the field already equipped with the tools to navigate cultural differences, reducing the disparities we see in client outcomes today. It's your personal responsibility as being a supervisor to make sure that this is included in your supervision process. Embed cultural humility expectations in supervision competencies. Ensure that cultural responsiveness is included in formal supervision competencies and training evaluations. Supervisees could be evaluated not just on technical skills, but also on how well they integrate cultural considerations into their client interactions. As a supervisor, you could integrate cultural humility benchmarks into supervision competency checklists, ensuring that it is assessed alongside other core skills. When cultural humility is treated as an essential competency, it reinforces its importance as a non-negotiable professional standard. If cultural humility became an industry-wide competency, we would see a shift of how behavior analysts engage with diverse populations, leading to greater client satisfaction, improved intervention outcomes, and a more inclusive profession. All right, here it is. Let's look at some real-life examples. A new supervisor expresses interest in cultural humility, but says that they're too busy to focus on it. What's the best response? A, encourage them to integrate small cultural discussions into existing supervision time. B, agree with them. There's not always time to focus on cultural issues. Or C, suggest waiting until they have more experience before prioritizing cultural humility. The best answer here is A. Cultural humility should be woven into supervision naturally, not treated as an add-in. Your organization wants to improve its approach to cultural humility and supervision. What's the best first step? A, develop a structured rubric to measure cultural responsiveness and supervision. B, require all supervisors to attend a single cultural humility training. Or C, let supervisors decide individually how they want to address cultural issues. The best answer here is A. Sustainable change requires measurable benchmarks and ongoing assessment. You now have the tools, strategies, and systems to make cultural humility a permanent part of your supervision. But real change isn't about knowledge, it's about commitment. In our final section, we'll reflect on the bigger impact of this work and how you can carry it forward as your role as a leader in the field. Now it's your turn. How will you ensure cultural humility isn't just a value, but a lived practice? Your commitment today can set the standard for the future of the field. What if every supervisor committed to cultural humility? How would that change our field? Throughout this training, we have explored how to embed cultural humility into supervision, making it a structured, measurable, and sustainable practice. The key steps in this process we looked at were understanding cultural humility in ABA supervision, identifying why cultural humility is essential in supervision, and recognizing personal biases that may impact supervisory practices. Strengthening the supervisory relationship through cultural humility, establishing trust, psychological safety, and open communication so that supervisees feel empowered to discuss cultural challenges. Implementing culturally responsive supervision practices, embedding cultural humility into supervision through structured discussions, adapting training approaches, and fostering open conversations. Locking in cultural humility as a standard in supervision, establishing measurable standards, structured feedback systems, and mentorship models to ensure cultural humility is sustained over time. And finalizing the transformation. Committing to long-term action, overcoming barriers, and ensuring cultural humility remains a core value in supervision. Cultural humility in supervision is not a static skill. It's a lifelong commitment to learning, adapting, and improving. This framework is about ensuring that the cultural humility practices we've developed don't fade over time, but instead become ingrained into the very fabric of how we supervise, mentor, and lead. The real work begins after this training and how you choose to apply, sustain, and refine these strategies over time. Here are your action steps for sustained change. Create a personal cultural humility action plan. Outline specific measurable commitments to integrating cultural humility into your ongoing supervision practice. Example of this could look like, I will initiate a discussion about cultural considerations at least once per supervision cycle. I will seek anonymous feedback from my supervisees twice a year to assess my cultural responsiveness. Remember that making a formalized commitment improves follow-through and long-term adherence to cultural humility principles. Establish an accountability partner or peer network. Share this training with colleagues, discuss cultural humility in staff meetings, and encourage collaborative learning. Identify a fellow supervisor or peer who is equally committed to cultural humility and supervision. Set up regular check-ins to discuss progress, challenges, and insights gained through applying these practices. Create a peer accountability journal where supervisors log reflections and share best practices. Studies show that supervisors who engage in ongoing peer reflection maintain cultural humility practices at a significantly higher rate than those who work in isolation. Continue learning and advocating for cultural responsiveness. Engage in professional learning communities. Seek mentorship, peer discussions, or CEUs focused on cultural responsiveness. Advocate for systemic changes that make cultural responsiveness an integral part of supervision structures in your organization or community. Propose a cultural humility training module for new supervisors in your workplace. Lead a discussion group on cultural responsiveness and ABA supervision. Long-term commitment to advocacy helps shift cultural humility from an individual effort to an industry-wide standard. Think back to the moment I shared earlier in this training, the time when I realized I had completely overlooked a family's cultural perspective. I thought I was making the right clinical decision, but I had failed to consider the deeper meaning behind their concerns. That conversation changed the way I approached supervision and client care, and it was the moment I made a commitment to cultural humility in my practice. But that commitment didn't just impact one family. It changed how I engaged with every family after that. It shaped how I trained RBTs, how I structured supervision sessions, and how I listened, not just clinically, but culturally. Over time, this shift didn't stop with me. The RBTs I supervised began to ask better questions and listen more deeply to their clients. Families felt more heard, and culturally responsive discussions became a natural part of supervision, not an afterthought. What started as a single realization turned into a lasting shift in my professional approach, one that influenced those around me, just as their growth will influence the next generation of behavior analysts. This is the power of cultural humility, guys. One commitment can create a ripple effect that transforms not just your supervision, but the entire field. Your decision to implement cultural humility does not stop with you. It extends to your RBTs that you supervise, the clients that you serve, and the future generation of supervisors who will learn from your leadership. This story is not just about me. It's about every supervisor who chooses to listen more deeply, challenge their assumptions, and make cultural humility a priority. That single moment of realization didn't just change how I supervised one RBT or one family. It reshaped my entire approach. Your commitment to cultural humility can do the same. It has the power to transform you and how you supervise, how you engage with your RBTs and families, and how the next generation of behavior analysts will carry this work forwards. The impact starts with you, but it doesn't end there. Cultural humility and supervision isn't just a skill, it's a responsibility. Every conversation you have, every moment you listen before responding, and every time you acknowledge your own growth, you are shaping the future of our field. Supervision is where change happens. The way you lead today will influence not just your supervisees, but the clients and families they serve, and the next generation of behavior analysts who learn from them. So ask yourself, how will you ensure that cultural humility isn't just something you value, but something you live? To make cultural humility a sustained practice, small, consistent steps are key. This 30-day action plan provides structured incremental actions to help supervisors integrate cultural humility into daily supervision. Week 1, awareness and reflection. Days 1 and 2, identify one personal cultural bias or blind spot that may impact your supervision. On days 3 and 4, read an article or research paper on cultural humility and ABA. And on days 5 through 7, review past supervision sessions and note any missed opportunities for cultural discussions. In week 2, look at intentional cultural discussions. Days 8 through 10 begin each supervision session with a cultural check-in question. And on days 11 through 14, ask supervisees for feedback on cultural responsiveness in your supervision. During week 3, look at application and skill building. On days 15 through 18, adapt your feedback or training style to better match a supervisee's cultural background. And then on days 19 through 21, review your organization's supervision policies. Where can cultural humility be reinforced? And then in week 4, let's look at commitment and accountability. On days 22 through 25, draft a cultural humility commitment statement outlining how you will sustain these practices. On days 26 through 28, identify one peer mentor to provide feedback on your growth in this area. And then on days 29 through 30, reflect on progress, what's changed, and what can you continue to do long term. Commit to revisiting this plan every 3 to 6 months to refine your cultural humility practices. Cultural humility isn't a box to check. It's a lifelong commitment. Let's make it a standard together. Before we wrap up, I want to take a moment to say thank you and give you your last code word, which is cactus. C-A-C-T-U-S, cactus. Thank you for showing up, for your supervisees, for your clients, and most importantly, for yourself. Choosing to lean into cultural humility isn't always easy, especially when you're already juggling so much, but it is powerful. The work that you've done here in this training has the potential to shift the entire trajectory of your supervision practice, and that impact extends far beyond your immediate team. Now, don't forget, if you're collecting CEUs for this training, be sure to input the code words into the quiz to unlock your certificate. It's how we verify your completion and make sure that you get credit for all the learning you just crushed. This might be the end of the training, but it's just the beginning of the transformation. Keep going and keep growing, and keep leading in a way that reflects the future of our field, one rooted in connection, curiosity, and cultural humility. Thanks again for being here. You are exactly the kind of supervisor that our field needs.